Hello guys, welcome to my YouTube channel Legend of Pharmacy. Today let's discuss about the Pharmacology-1 very important questions for your 2023 examinations. The main intention of this video is just to give you important questions. Okay, with answers means how can you write these all. This is the main intention of my video. So you subscribe our channel Legend of Pharmacy and try to share this video with your friends. Notes from Let's Join Pharmacy. If you want the notes, means notes also are available for the Pharmacology-1. It costs 50 rupees per subject. If you want, you can get it. In the description there is a WhatsApp link or number, there you can ask me. Important questions with answer of Pharmacology-1, 10 mark. See, what are ion channel receptors? Explain their transduction mechanism. First you have to define what is these receptors. Then you have to classify the receptors, then go for ion channel receptor, then mechanism you write with figures. Mechanism of action with figure means the structure of that ion channel receptors, how the ions get passed, okay, that all you have to maintain. What are non-selective beta blockers? Explain the pharmacology of any one non-selective beta blocker. See, you know that beta blocker, these are the anti-hypertensive drug. If you write on anti-hypertensive drug, no problem. One point you remember here, note, if any drug pharmacology asked, then at least you write definition, classification, example, uses, side effects, contraindication, then ADME. That is adsorption, distribution, metabolism and excretion. If you don't know anything, at least you write uses, side effects, contraindication. Absorption means maximum drug they get absorbed where? Yes, in the kidney, in the stomach and in the small intestine. Distribution throughout the body. Systemic circulation. Metabolism, mainly the drug metabolized in the liver, sometimes in the kidney also, but liver is the main here. Liver is the one of the very important factor. And excretion or elimination from the urine, okay, from the kidneys in the form of urine or in the form of fecal matter. This you have to remember for all any pharmacology. Classify anti-epileptic with example pharmacology of the phenytoin. Just you have to classify these anti-epileptics. Then you have to, anti-epileptics is nothing but the anti-seizures also. These are both same, anti-epileptic and anti-seizure drug. You can write the same for this. Then explain about the signal transduction mechanism of G protein coupled receptor. Just you have to explain about the G protein coupled receptor here. Are you getting? Yeah. What are the different stages of general anesthesia? Means pharmacology of anesthesia you have to explain here. 3 types of main anesthesia, general anesthesia they have asked. 3 mainly. Yeah, how you wrote in medicinal chemistry law, no, same you have to write here. But structures are not important here. Okay, what is anesthesia? Classification of anesthesia. Inhalation anesthesia. Then short acting benzodiazepines. At last is a dissociative anesthesia. This is all you have to write down. Then classify antidepressant drugs with example and pharmacology of imipramine. Same. Definition, definition, side effects, uses, contraindication, these all you have to maintain. Classify sedative and hypnotic drugs with example pharmacology of the benzodiazepines. This question also repeated in where? This time in 2023 medicinal chemistry, this question they were asked, sedative and hypnotic, and write the SAR of the benzodiazepine. Maybe there is a high chance of asking here also. So go same you have to write except structures. Write note on different routes of drug elimination. Here you have to define different routes of drug eliminations are there. Classify that with an appropriate example. Discuss about the mechanism of action. You know that what is this mechanism of action of drug. Here you have to write the what is the mechanism of action. Many principle are there on the mechanism of action. Means different drug having the varieties of mechanism of action. Okay, not the particular say all drug having same mechanism. No, different drugs mechanism of actions are there. On the basis of the mechanism of action, we can know the therapeutic effect, irritation or toxic effect. Okay, then replacement. These all depend on the mechanism of action only. Write brief on adverse reactions of the drug. Adverse reaction, side effects we have to write. Adverse reaction means, and also you can explain any one drug side effect. Paracetamol, what is the side effect? Long term uses of steroids, what is the side effect? These all are the general questions you have to write down. Pharmacology of the sympathomimetic agent. Sympathomimetic agent also known as a cholinergic agent. Write down this one. Cholinergic agents or cholinergic agonists these are. Pharmacology of the succinylcholine. Succinylcholine is the muscle relaxant. We have to write the pharmacology on succinylcholine. Then write any 5 functions of autonomic nervous system. Autonomic nervous system, what is this? And you have to explain that where the autonomic nervous system is present, functions you write, and also one drug you have to write on autonomic nervous system. Autonomic nervous system, it is also called as here parasympathomimetic agents are used. Parasympathomimetic, that is anticholinergic agents. Which one? Anticholinergic agents. Neostigmine, okay, psychostigmine. These all are psychostigmine. It is used to decrease the toxic effect of atropine sulfate. Means atropine sulfate. It is alkaloid. And what is the therapeutic application of a disulfiram? Disulfiram therapeutic application you have to write. You know that disulfiram, it is the drug which is used to stop the use of alcohol. If a person is drinking huge amount of alcohol, then disulfiram helps to prevent him. Means that alcohol it form complex inside the body. Okay, inside the body, and whenever the person will drink the alcohol, the alcohol will get vomited because of the complexation. What is the role of GABA? Simple. Here you have to write in central nervous system, where does this GABA synthesizes? Okay, that you have to write. And one neuron means just this type of the neuron diagram you have to draw. Where does this GABA receptors are present, and you have to also explain the receptors of GABA 1, GABA 2. These all you have to explain and write the functions. Then write about the enzyme induction and enzyme inhibition. Yes, you have to write here what is the factors affecting induction. Induction means increase. How enzymes get increased. Examples you give like cytochrome P460. Many examples are there for increasing. Inhibition means reversible is there, irreversible there. How you wrote in biochemistry, same you can write here. Fixed question this one. Write a note on metabolism of drug phase 1 and phase 2. Simple. Phase 1 and phase 2, that is biotransformation, drug metabolism, you have to write down here. Explain the pharmacodynamic drug-drug interaction. Pharmacodynamic, pharmacokinetic. 2 type drug-drug interactions are there. Write down that. Explain this. What is this? Pharmacodynamic means just dynamic. They will explain about the mechanism of action, side effects, uses. And here drug-drug interaction, drug-fruit interaction is there. But here you have to explain the drug-drug interaction. Sometimes drug-drug interaction, they will increase the therapeutic effect. Drug-drug interaction, they will decrease the therapeutic effect. They may toxicity, they can produce toxicity, they inhibit the toxicity. These all principle you have to write. Then explain about the drug tolerance. Drug tolerance means tolerance developed to the drug. That you have to write. Principle of that. Tachyphylaxis also you can add it here. Pharmacology of the psychostigmine. Yes, it is the anticholinergic drug or parasympathomimetic drug. Pharmacology of any one of the benzodiazepines. Anyone, you take diazepam. It is also one of the benzodiazepine. Pharmacology of any one of the central acting muscle relaxant. Yes, here central acting muscle relaxant. It is known as a succinylcholine. So they have not given this succinylcholine, but for your understanding purpose, I have given this. Okay, this central acting muscle relaxant comes means you have to write the pharmacology of the succinylcholine. If they ask in the exam, what you will write? Yes, if they ask in the examination on the central acting muscle relaxant, then you have to write the succinylcholine. And write brief notes on opioid antagonistic drug, naloxone and naltrexone. These drugs pharmacology you have to describe. Yes, thank you for watching this video. So these are the very important 10 and 5 mark question. Subscribe our channel Let's Jam Pharmacy. If time reveals means I will add 2 marks questions with answers. Thank you.